Well, flu season will be here before you know it, and now's the time to get the shot. And joining us today, the Medical Director of Population Health at Mercy Health St. Rita is Dr. Kahle to tell us more. And thank you, Doctor, for joining us.
Thank you for having me.
First, let's start out last year, because I believe of a lot of masking and things with the pandemic. Flu season was kind of mild. What are you predicting for this year?
It may be unpredictable, unfortunately, that because of a lot of the things that we've seen with COVID-19, we could have a relatively mild flu season. However, we might have one that's a little bit more severe because we did not see as much flu last year.
So I feel like that's something to prove that masks work. If we didn't have very much flu last year, is this because we weren't spreading it around as much because of wearing masks?
Yes, both COVID-19 and the influenza virus are contracted via respiratory means. So wearing masks does help to prevent some of the particles that get transported to the air that might infect another person.
But let's get the shot, right? I mean, we talk about getting the vaccine, that's important, but we also need to get the flu shot too.
Yes, with the data that we have right now, it does appear safe to get both the COVID-19 vaccine and the flu vaccine even on the same day. From what we've seen thus far, there is not an increase in side effects for either of the vaccines by doing that, or a decrease in the effectiveness of them.
All right, that's good news. So when's the good time period to get the flu shot? I mean, is it right now or month of October? Because, you know, flu season can last into the spring.
Yeah, it's recommended that most people receive the flu vaccine sometime between August and the end of October. The end of October is kind of the deadline that we encourage people to get it by. The effectiveness of the flu vaccine will last about for 6 months or so. The flu season typically starts in late fall, around November, and then will peak in midwinter, and then usually start to die off around the early spring. So if you're able to get it now, it gives you that 6-month time frame to last through the entire flu season.
And plus, it's helpful to the medical community to get the flu shot too, because you don't need to see extra people in the hospital, because people do get hospitalized with the flu.
Yes, especially with COVID-19 right now and seeing an increase in hospitalizations, it's important that we try to reduce the amount of patients who may contract serious illness from influenza as well. So that's where the flu vaccine can help to protect against that.
Is there an age population that you want to get the flu vaccine?
Generally, anybody over the age of 6 months is eligible to receive it. We do highly encourage our vulnerable populations, meaning that if you have any chronic medical conditions, if you are over the age of 60, that we do encourage that you try to get the flu vaccine.
And typically flu shots you can get at pharmacies, doctors, I mean, it's around, right?
Absolutely. Most primary care doctors will carry this in their office. Almost every pharmacy will also carry this. Typically this time of year, we start to do some community flu vaccine events. So those are something to look out for as well.
All right. So get the COVID-19 vaccine and the flu shot, and hopefully we have a nice mild winter.
I hope so.
All right. Well, thank you, Doctor, for joining us today.
Thank you.
All right. Don't go away. Noon Edition continues in a moment.